This is our website for mainstream issue of drug use. To start, 50% of people 12 and older have admitted to trying illicit drugs, according to the National Center for Drug Abuse Statistics. Also in 2020, the federal budget for drug control was $35 million. Drug abuse is the root of many issues among those suffering from addiction. It not only can poorly impact their health, but also have a negative impact on their relationships and careers. Drug abuse can also have a negative impact on communities, as when people are under the influence, they tend to act irrational and participate in risky behavior, like committing a crime. Although there are preventative measures in place to stop drug abuse, such as educational programs and treatment facilities, it is important they continue to improve. Over the course of the semester, our research group has analyzed different communities to see what public health issues need to be addressed. We found drug abuse to be a major issue in many communities and made it the focus of our work in order to prevent the issue from worsening. For the walking and windshield survey, the walking and windshield survey is an observation of a community that can be completed by the surveyor by either walking or driving around the community. The survey focuses on issues in the community that need improvement, whether that be healthcare, public space, or transportation. This helps bring awareness as to why and how the community can improve. How to perform this survey is to study a map before you begin walking or driving, explore areas of the community, take notes as you go, and work in groups if possible. These were the results. According to the 2021 United States Census report, there were 1,533 residents in the town of Wagner. Wagner itself holds a very little educational opportunity past the high school level. The biggest employers of this community are private companies, as well as local, state, and federal employers. Healthcare facilities such as a hospital, Indian Health Services, nursing home, and private entities such as a chiropractor. Again, according to the same United States Census, the population of Vermilion is 11,802. There are many educational opportunities available, as schools offer kindergarten through high school. There's also a college university. There are many privately owned businesses, as well as big corporate businesses like Walmart that also offer employment opportunities. There's also a hospital, chiropractor, and physical therapists available, as well as mental health facilities. According, again, to the same United States Census, the population of Eden Prairie was 63,161. There are multiple public schools in Eden Prairie offering education, kindergarten through high school. There are many businesses in the community that offer employment. Health services are also prevalent, such as hospitals and mental health services.
For the issue, all across the United States, drug use is on a surging rise. Drug use can cause many problems in an individual's life suffering from addiction. It can cause both physical and mental problems. Increased drug use also affects society, as it creates a demand for more health professionals to help combat the issue, and also puts a strain on law enforcement as it creates more crime. When it comes to health, drug use can create many health problems for an individual, as they may become dependent on it. It can also cause psychological impairment and disorders to arise. Drugs can cause people to participate in risky behaviors or to do illogical things, such as committing a crime. This puts a burden on law enforcement and may force more funding go towards supporting them. And in worst cases, drug use can cause many unintentional deaths. The CDC reported a 32% increase in drug-related deaths from 2019 to 2020. Some risk factors: early drug use, drug availability, low socioeconomic status, lack of guidance, stress and anxiety, alienation from peers and family. And some statistics: adults ranging from 26 and older have doubled drug usage since 2015. In December 2022, 11% of 8th graders, 21.5% of 10th graders, and 32.6% of 12th graders reported drug use. Patients who receive opioid prescriptions after surgery have a 44% chance of increased use. Although there are helpful resources to combat drug use, only 5% reach out for help. And interventions. Drug abuse is a very prevalent and dangerous issue in many communities, but also is very preventable when proper interventions are in place. Having education programs in place helps stop the problem from ever starting. It also is important to have proper recovery programs in place, as well to help those already affected by drug abuse. Having these interventions readily available will help resolve drug abuse and the issues it causes.
Primary intervention, early education. Offering primary intervention and education programs that target teenagers can be very effective way to stop drug use and prevent it from being prevalent throughout one's life. More often than not, people are first introduced to illegal drugs and other substances in their teens and be more likely to experiment with them due to pressure from their peers in order to fit in. But beginning drug use at this age can have lasting effects that can lead to poor physical and social health. That is why it's important this age group have programs available to educate them on positive ways to stay away from using drugs. Life skills training is a classroom-based educational program that targets teenagers and gives them skills to remain abstinent from drugs. There are three main components of this program, which are drug resistance skills, personal self-management, and general social skills. A recent study done by the National Gang Center found the life skills training program to cut alcohol, tobacco, and marijuana use down by 50 to 75%. When it comes to long-term effects, the study found this program to cut polydrug use by 66%. Providing primary intervention programs such as life skills training to the younger population not only has been shown to be effective, but is also able to target a large population, cutting future drug use down. These programs provide crucial life skills that individuals can carry with them and use all throughout their life to stay away from dangerous drug use. Secondary intervention, outpatient treatment. Sometimes it's inevitable that an individual may begin drug use due to several reasons, but it is important that those around them by accepting and supporting in order to get them the help they need, as they may be ashamed to reach out for help. That is why it is important that secondary intervention programs that be available in order to address and stop the drug use before it escalates even further. One effective secondary intervention program is the Minnesota 12-step program, which is similar to Alcoholics Anonymous with the addition of a number of doctors and psychologists. In a study done by the National Library of Medicine, researchers compared drug use over a span of 12 months among those who completed the 12-step program and those who did not. Researchers found 53% of those who completed the program to be completely abstinent from drugs compared to only 28% of those who did not. Making sure treatment centers and programs are accepting to individuals experiencing drug abuse plays a crucial role in whether or not they reach out for help. By removing the judgment surrounding those who struggle with addiction can help entice them to reach out for help and get the proper help they need before the addiction worsens.
Lastly, there's tertiary intervention, which is inpatient treatment. When drug use becomes a serious problem or disorder in someone's life, it is important that rehab centers be available. Rehab centers offer inpatient care to individuals suffering from addiction, and treatment often includes a form of medication and cognitive behavioral therapy. Rehab centers can differ in many ways, such as how and what they offer for treatment. However, centers that focus on relapse prevention had the highest success rate. A study done by the American Addiction Centers found that 50 to 70% of those who were in a program that focused on relapse prevention stayed clean upon their release. Although relapse is sometimes inevitable, as some addictions are stronger than others, it is important that they still be given tools that focus on preventing them from relapsing. This is the health belief model. The health belief model focuses on behavioral change and states that personal beliefs influence their health. These individuals will be more likely to take action if they believe that they are susceptible to harm. There are 7 different stages of how the model is, and that is listed below. The first is perceived susceptibility. Many people believe that trying or experimenting with drugs and other substances will not lead to addiction or lifelong problems. The second one is perceived severity. Some of those who are in the early stages of addiction believe it is just a phase and they can quit whenever they want. Obviously, we know that that is not true. The third is perceived benefits. Educating the public on how serious experiment with drugs are and the lasting effects that it can have can decrease early drug use. The fourth one, perceived barriers. Some may view these education program classes as boring or a waste of time and neglect how important the information truly is. Fifth one, modifying variables. Those in high school and college may view drugs and other substances as a norm and ignore the consequences and skills on how to stay away from it, but these skills can positively benefit them throughout their life. 6, the cues to action. Peers could have been harmed by drugs or other substances, so they may view these education programs as beneficial and important. And lastly, there is self-efficiency. By learning the consequences of substance abuse and how to stay away from it at a young age, more people will be equipped with the skills to remain abstinent from drugs throughout their life. And then lastly, for a conclusion, we believe that as drug use continues to grow and worsen across America, so will the issues that come along with it, which have a negative impact on communities such as Eden Prairie. This is a very preventable issue if proper education and support is put to use. Educational programs like the Life Skills Training Program has proven to be effective when it comes to keeping adolescents away from drugs and gives them life skills to help them throughout their life. But when individuals have already been affected by drug abuse, it is important programs such as rehab facilities to be supportive and welcoming. These programs also become more effective by establishing things such as Minnesota's 12-step program and focusing on other things as well, like the relapse prevention. Moving forward, we think that it's important to use educational problems to target adolescents, to make sure that support groups are welcoming and understanding so people will actually go, and to make relapse prevention the focus of inpatient treatment. Our last slide shows our sources, our references.